Most illness is bidirectional. A affects B and then B affects A. It's basically organic. So in a sense, there's multiple systems that are going on that are affecting and being affected. That complexity is something that long COVID is going to help us understand, because it's not simplistic A to B, linear thinking. It's going to be basically much more connected research that's organic. And that type of organic system is the way nature really is. Nature isn't simple, it's complicated.
Welcome to the Hope and Help podcast, where we talk about science and science-based tools for fatigue and chronic illness. I'm Halie Pomroy, #1 New York Times best-selling author of The Fast Metabolism Diet and the Assistant Director of the Integrative Medicine Program at the Institute for Neuroimmune Medicine. Today, we're tackling quite a big subject. We're going to talk about long COVID, post-viral illness, and pacing for people with PEM, and we'll talk about what that is. I am so fortunate today that I am joined with and by Dr. Leonard Jason. Dr. Jason is a professor of psychology at DePaul University. He is also the director of the Center for Community Research. He has served on many communities of the NIH and has received over $47 million in federal research grants. Dr. Jason, thank you so much for taking time today to talk to us about this really important subjects.
Thank you. Happy to join you.
It's very exciting to have people like you come and have these conversations. I'm always torn a little bit because it's a little bit heartbreaking that we have to have these conversations. But at the Institute, we have access. We always have this like clinic without walls. We have access to so many individuals that bring a different perspective. And Dr. Klimas wanted us to have a conversation and kind of jump in about what's going on and what we're seeing in the world right now with health. And so I'd love to first tackle the concept of post-viral illness in general. That's new for a lot of people, maybe not in research, but for a lot of us out in the world, this post-viral illness is a whole new concept for us. Can you give me a little bit of color about that?
So if we go back to any viral illness or even bacterial illness, what you have is a certain percentage of people who get sick and continue to have persisting symptoms over time. That's really the key issue. That hasn't always been recognized, but now that we've gone back to many different pandemics and different types of viral outbreaks, we see the same thing. A certain percentage of individuals do not recover.
So is it the body's response to the infection, or is it the infection? I mean, are there components that the infection itself causes a problem, or the way the body responds to the infection?
So let's talk about SARS-CoV-2 for a second. 95% of persons who are age 16 or older have been affected by it. That's either through either previous infection or vaccination by 2022. So let's think about what's going on with SARS-CoV-2, which is a model for all the different types of viruses that have happened to people. You have an infection, and then you have some behavioral changes that occur, such as exhaustion that reduces physical activity. What that does is increases the amount of energy available to eliminate the infection. So what we're talking about is hibernation. This represents what is occurring. The individual is slowed down with fatigue so that, in a sense, they can basically begin to recover.
Hey folks, it's Nancy Klimas. Thanks for listening to the podcast series. We have a lot going on and a lot of research going on in ME/CFS, in Gulf War illness, in long COVID, Parkinson's disease. You'll find that we have a number of trials going on, clinical trials and different types of studies. To learn more, just go to our webpage on the research tab at nova.edu/NIM, Neuroimmune Medicine, and you'll see everything that's going on right now. We even have patient conferences every year. We have one coming right up. So check out our webpage. Thanks.
And the body just innately knows this. I mean, I know when I get sick and people tell me, go to bed, rest, but genuinely the fatigue comes on and the body knows this to conserve energy for healing. How come some bodies don't rebound, like long COVID?
So the only way we're going to have real answers to that is, I think, by longitudinal prospective studies, where you actually find people before the trigger event, the viral infection. Take a look at how they look, what are some of their areas of how their strengths are, and then see what happens to those who recover and those who don't recover. That's the way you answer that question. Right now, our best sense is that some of those risk factors include things like type 2 diabetes, obesity, elevated blood pressure, chronic lung disease, depression. Those types of things seem to increase the risk of people having difficulties recovering.
So a lot of the chronic diseases or comorbidities that were already metabolic dysfunctions in the body make it harder for a body to recover from an acute illness. Is that what we're thinking?
That's probably that's a very good observation, and I think that probably summarizes it best.
So when you talk about exhaustion and energy, I want to jump into what we call PEM. Can you first define that for people? It's a lot of times people, from a judgment perspective, in my opinion, just say, "Oh, you're just tired," but it's very different. What does PEM stand for?
So PEM stands for post-exertional malaise, and a lot of people who are in primary care and healthcare often think of fatigue. And truthfully, fatigue is the most common symptom of what we think of as kind of when people don't recover. But post-exertional malaise is something different from the garden variety fatigue. Fatigue is very common in the population. About 1 out of 4 people have fatigue at any one time. Post-exertional malaise is something that involves when you exert yourself physically or emotionally, you not just feel fatigued, but you feel sick. You feel as if there's almost a poison that's going through your body. It's a very different experience than just pure fatigue.
My name is Jimmy Orocho. I am a veteran of the 1990-1991 Persian Gulf War, Desert Shield, Desert Storm. I work for Dr. Nancy Klimas at the Institute for Neuroimmune Medicine in Nova Southeastern University. We are in Davie, Florida. We are Gulf War illness clinical researchers in the need for research participants. By participating, you will help yourself and your fellow veterans, contributing to the discovery of the cause of Gulf War illness and how to best treat the illness. Our telephone number, 954-262-2870. Our email, QuickTick, Golf Whiskey India Charlie Tango India Charlie @nova.edu. We do also decentralized clinical trials. That means that you may be able to participate in this research from your hometown. Thank you very much.
This is something that we find common in post-viral patients.
So there are individuals who have post-viral illnesses that basically have fatigue, which is probably more common, but actually those who have more severe disruption of their activities would have PEM. And that also begins to think about an illness that's really characterized by PEM, which is ME/CFS, myalgic encephalomyelitis, chronic fatigue syndrome. But that's something we'll talk about. But certainly, yes, PEM does occur with some cases with people who have what's called kind of post-viral COVID or long COVID.
So in our space, when the pandemic started, or when we started seeing this coronavirus or this specific virus, fairly early, a lot of the neurologists and immunologists started to see that studied ME/CSF, started to see a correlation between what the patients were exhibiting. What were you seeing, and how early on were you able to see, or your group see, the correlation?
So let's first define what ME/CFS is.
Perfect.
Most people refer to it as chronic fatigue syndrome. Europeans usually call it ME, which is myalgic encephalomyelitis. So that's why in the US and some countries, there's the acronym MECFS. There's really several characteristics. And just think of it this way. If you have SARS-CoV-2 and you have persisting symptoms, most people will eventually recover. But there's going to be a certain percentage that maintain severe symptoms over a long period of time, which means years. Those people ultimately will be classified as MECFS. And MECFS is involving things like reduction in activity that's substantial, unrefreshing sleep, cognitive impairment, and post-exertional malaise, which is what we're just talking about. So yes, that is characterizing, and the individuals who have this MECFS generally are not improving over time, whereas the people with long COVID, a large percentage of them are going to have symptoms reductions and improvement. So, but the folks who don't, right now, there's estimates that about sometimes as many as 45% of people with long COVID might be classified as MECFS at some point, depending on which laboratory you're talking about.
Wow, that's a lot. It's amazing because I think that individuals that studied or were doing the research in MECFS were so ahead of the curve when we started seeing these patients have these types of symptoms, whether it was, we also saw a lot of POTS in those patients, the inability to regulate kind of the autonomic nervous system as well. What types of, I'm going to say, behavioral impact happens when a person is dealing, like, what happens in their world and in their bodies?
So think of it this way. We're still trying to understand the different systems in the body that become dysregulated.
Right.
And why certain symptoms seem to be worse at certain times, and then other symptoms are worse than other times. And for example, the stomach, the gastrointestinal system is communicating with the brain. The brain's communicating with the circulatory system. So all the systems in the body are talking to each other constantly. And if we just look at one piece, we're not going to see the whole pie. So that's the challenge to medicine, to basically try to understand these different systems and how they interact with each other. With these types of post-viral illnesses, when they've actually looked at symptoms, there's hundreds of symptoms, so that it gets manifested differently by each person. Although there's some commonalities, and I guess what we've been talking about is that, fatigue is very common. Difficulty focusing is very common.
Right.
Some kind of bronchial, kind of breathing problems are common, but the number of symptoms is just mammoth.
And so with individuals that are struggling with this, how I know that a really significant passion of yours is adequate diagnostics. What kind of diagnostics are we looking at to, and I know this is new and fresh, but looking at to identify if a person's still dealing with this? I mean, we were all thought and told that this was going to be, a 10 to 14 day episode that happened in our bodies. And now we have this, it feels like massive amount. And a lot of young people, my kids' age, are dealing with a lot of this post-viral issues.
So diagnostics really involves classifying. And we need to classify people with SARS-CoV-2 into three categories. One category are people who have some type of lung kind of organ damage. So their lung is scarred, they have blood clots, renal failure, neurological complications, heart damage. So those are people in one category. Another classification of people are people who had something before and now it's been intensified. So the diabetes is now much worse than it was before. That's another cause. But the third category is the one that I'm most interested in, is those that don't have any observable organic damage. They're the ones that are closer to the MECFS group. We're trying to sort of say they're unwell, they're not feeling well. They basically go to practitioner after practitioner. A lot of the standard medical tests look like they're okay, but the person is ill. The person is very suffering from lots of symptoms. That's the group. that I think is most, and that's the challenge to medicine. What do we do with those unexplained symptoms? Because ultimately, there's probably an explanation. We just haven't been clever enough to find it.
I love that because I had a client that, one day got COVID and, about probably midway through COVID, but definitely shortly after, went into full-blown type 2 diabetes. Never had a history of it, never flirted with it. Hemoglobin A1C was beautiful. And something with that inflammatory or insulin or something triggered that, right? And then we have this group of patients and a lot of individuals in our community that, their echoes are clear, their lung scans are clear, even their MRIs are clear. But sometimes, and we see this with our ME/CFS patients, is if we can get them in that malaise period of time and run some of our immunolabs, we'll see their immune system and their autonomic nervous system, the ability to regulate, is completely, from a chemistry perspective, out of balance.
So part of the problem is when people have these types of symptoms, it's hard to find practitioners who actually have the types of advanced diagnostics to figure out what's going on. So let me just give you kind of example dealing with the cognitions, because that's very problematic. If you can't remember where you're going or where things are, or your memory or concentration, that's going to have a lot of serious consequences for you at work. So let's see what happens when the brain has low-grade inflammation. That can be caused by the infection. So what happens? In a sense, to that person has a lack of oxygen to the brain, and basically the white matter that contains long nerve fibers which transmit information from one brain region to another, that diffuse white matter disease might be contributing to the cognitive difficulties. But this is kind of what's really exciting, that there's basic research that's now going on that you're not going to find at most typical medical settings. But this is probably what's going to be pushing the field forward into the future. So let me give a little bit of information about some of the most exciting research that's going on in the country. Microglia basically is white matter in the brain, and it's responsible for pruning the connections between neurons to improve neural circuits. So, for example, during anti-cancer treatment, their activity is disrupted, and that causes brain fog. Well, microglia in the brain react to the immune activating molecules called cytokines, which are released in response to COVID infection.
Right.
So here you see an infection causing cytokines, impacting the brain, causing some significant problems with cognition. That's very complicated. And that's probably where the best research will be going, to us understanding what is going on that's causing these cognitive problems that people are having. It's not going to be a simple solution.
And is that some of the hope for the future for long COVID patients? Like, the brain is we always say it's easier to hit the body than the brain, right? And maybe you can explain that to us a little bit. Is it the blood-brain barrier? Is it that there's mast cell response? Are we looking for how to impact this? What are you seeing in the future for these patients?
So the negative thing is certainly patients are suffering, hundreds of thousands, millions. The positive thing is that there's millions and hundreds of millions of dollars that are going into basic research. And this research is going to have to be looking at systems. It's going to have to be looking at how one system impacts another system, and that how one set of symptoms at one time is predominant, and then it becomes the fade and it affects another system.
I love that, because I think it's a complete change in the trajectory of medicine in a way, because we started specializing, years ago, right? And it was like the heart could live without the brain and the lungs could live without the large intestine. And I think with this complexity, we're seeing that the body is, a biodiverse unit, having this experience that you can't sever one part of the body from the other.
So think about basically medicine is very good at kind of basically taking care of a broken bone, broken arm. And that's A to B. You do A, you had a fixture, B, you fix it. But that's not the way most diseases are. That's not the way most illness is. Most illness is bidirectional. A affects B and then B affects A. It's basically organic. So in a sense, there's multiple systems that are going on that are affecting and being affected. That complexity is something that long COVID is going to help us understand, because it's not simplistic A to B, linear thinking. It's going to be basically much more connected research that's organic. And that type of organic system is the way nature really is. Nature isn't simple. It's complicated.
And I mean, I love what you say. You're preaching to the choir here, because I think with us understanding the complexity of the insult, we can value the complexity of the reversal, that it's going to take, a holistic or a whole body or a valued approach where we look at all the systems, that are interactive, what's gone awry, and how we nurture that body back into a healthier homeostasis. I don't think, I could be wrong. I hope I'm wrong. I don't think there's going to be a magic pill. I think there's going to be an understanding and a rebalancing.
And there's probably going to be different treatments helping different people with different types of things. It's going to be very kind of, in a sense, individualized. And you're right, because it's so many different factors here. They're all going to have to be taken into consideration in this personalized medicine that we will kind of be moving toward. By the way, if you're trying to differentiate those who have classic ME/CFS that could be caused by a different type of infection, kind of the Epstein-Barr virus, which causes mono, and people don't recover from mono, that's often causes ME/CFS, whereas SARS-CoV-2 is the cause of often the long COVID. But there's some ways that those two are classic differences. There's actually there's some symptoms that are specific to each of these different types of illnesses. One, for example, is kind of hair loss or kind of smell or taste in the long COVID. Well, in the ME/CFS, they have cold limbs and they have flu-like symptoms. So you often do get some specialized differences that if you have adequate questionnaires that has the specific questions, you can make those differentiations. The problem is most of the surveys that have been done are looking at occurrence, yes, no, of these symptoms. And that's not adequate. Understanding kind of whether something is trivial or something is a burden to the person. And that's why we have to learn from the people in the ME/CFS world who have been studying these unexplained symptoms for decades, as opposed to a lot of the people in the long COVID community that are new to the area of post-viral illness.
Yeah. And I think it's changing how, a lot of physicians and practitioners that we work with they said, I feel like we're completely going back to relearning, the systems of the body and how they interact and how things engage. My daughter recently got sick and was at the hospital, and the infectious disease doctor said, well, we don't really study the immune system. And I almost fell on the ground. I said, because why is she having this response? She's healthy. She's 22, and can you explain how we can look at her immune system or what's going on in her immune system as to why she's having this very strong response to a very basic, what was considered at the time a very basic viral infection. And literally I was told, we just don't, in infectious disease, we don't really look at the immune system. And I just didn't know. And we ended up having a lovely, over the 4 days that she was there, lovely conversations and philosophy. But when you say that there has to be, there's a change. I've already seen it in research, but there has to be a change in how we practice medicine. These patients are going to force the change in how we practice medicine.
So ultimately, you're going to have kind of a multidisciplinary team of individuals who are all put together for the needs of a particular person, because one specialty is not going to be able to provide all the answers. So the best, basically, way of thinking about navigating the future is to have something that's basically individualized, personalized, but has multiple dimensions. And truthfully, if you have a physician who basically isn't willing to have an open mind and read about new things and try to understand them, find a new physician.
I appreciate you giving us permission to do that. We tell our community that all the time. They're your partners in your health and wellness. And when I got brought on to the Institute to develop out the integrative medicine program, it was because they were practicing this individualized medicine and this multidisciplinary medicine. On our Friday clinicals, I mean, we have everything from, hematology to neurology, nutrition, behavioral modification, pacing, everything. And we discuss our cases and, some of the smartest people in the room, and we're all collaborating, right? And in that, there are so many, I guess, missed ideas that we would, if we were not looking at it holistically, missed ideas on behalf of that patient. And so if people are out there and you're feeling that way, what's some of the verbiage? You're so good about this. I was looking at the books. What's some of the verbiage that people can help articulate to get a good diagnosis that they're concerned? Let's go to long COVID first. There's a lot of people out there that are concerned that maybe you're identifying or you're speaking to them, right? They're going, that sounds like me. How do they talk to their doctor about it?
It's very important to select a doctor that you have a good relationship with, who trusts your experience. And if the doctor is basically not trusting what you're experiencing, regardless what it is, that's a very bad sign. So I would say the relationship is critical.
I love what you said about trust your experience. You're the one having that experience. You just gave me a lot of personal permission. You need to be with a doctor that trusts your experience. That's huge.
So initially I talked about kind of what's going on when a viral insult occurs, that the organism goes into hibernation. It happens with all mammals. On the plains of Africa, when a lion gets into a fight with another kind of lion and gets mauled, what does it do? It goes into the bush with the injury and stops eating, looks into the bush and stops doing anything and just sleeps. Why? Because it lets the body begin to take care of the injuries. That's what fatigue is a sign of. It slows you down and allows the body to basically heal. Now, if you have that experience and you have a healthcare team that is telling you, well, you'll feel better if you go to the gym 3 times a week and just work out.
Yeah.
That's not helpful.
Yeah. Eat less and work out more. I just breaks my heart.
If you talk to patients who have these post-viral illnesses like ME/CFS and long COVID, and you ask them, what's the single most helpful thing that they have been able to basically cope with the illness, do a little bit better? It's pacing. What that means is not pushing yourself beyond your limits. In a sense, it's staying within the energy envelope. So you have a certain amount of perceived energy, you have a certain amount of available energy, and you have a certain amount of extended energy. What do you expend? And if you're expending twice as much as you have available, you're a battery that's on overcharge. And ultimately that battery is going to get weaker. So the idea is to stay within the energy envelope, figure out how to pace. And that is listed again and again as the most helpful coping technique. We're not talking about curing a person, but we're trying to not make the person worse. We're trying to allow them to have a decent quality of life. So I would say, think about that. So think about your nutrition, think about your activity, which means you have to do something. You don't want to get deconditioned, but you don't want to push yourself so that you're feeling sick. You want to think about your life goals and what's important in life, and you want to think about the community that you're in. Those are the 4 parts that basically are involved in a long life as well as recovery from illnesses.
I love that. I absolutely love that. And I want to talk about a couple things. You mentioned pacing, which is a tip that we want everybody to walk away from today, and the importance of that, and the importance of it is, I think sometimes when we get individuals come in and we make a list of what we want to do and maybe what diagnostics we're going to run, pacing is right at the top there. And I think I love that energy envelope. You also mentioned nutrition. We integrate nutrition into our clinic with each of our patients. It's a cornerstone to wellness. Everything that we do is nutrient dependent, and healing is extremely nutrient dependent. And energy expenditure. Is there one thing that you would say, like, I'm a big, eat frequently, eat clean? Is there anything that you would say that you notice in the individuals that you've worked with that you see could be helpful for someone out there, just a basic for them to start with?
So generally, you want to have fats that are low, sugar that is low. And if you think about the typical American diet, a fast food diet is probably not going to be restorative. So
I love that.
So what you're looking for is the less processed you can make it, the better. The more you're basically in control of your diet, because ultimately that's the stuff, that's the nutrients. And the worst thing that happens is if you try to get overstimulated. Now, this is an illness that basically involves stimulus overload. And I don't know if you know this, but, a lot of the cognitive measures shows that there's cognitive problems with slowness of thought, difficult understanding things, difficult finding the right word or saying the expression. Well, that's only part of the cognitive issues. We found in our research at DePaul that there's another part: sensitivity to light, sensitivity to noise, sensitivity to smells. So there's an overloading piece as well in the cognitive. So if there's an overloading piece, you don't want to overload yourself with basically activity, with people, or with food.
I love that. And also with stimulants. Like, I'm not a big proponent for caffeine with people that are dealing with this. I don't like to see their body pushed. And I think sometimes we do caffeine and then we push our bodies past that energy envelope, and it distorts our ability to pace really well. I don't know if that's what I see a lot of times.
And this is how kind of symptoms are related to each other. So for example, you feel better eating some chocolate, or you're basically feeling better having some carbonated beverage. Well, if there's caffeine in that stuff and you're taking it before you go to sleep, that's going to blow your sleeping patterns.
Right.
So these things are all interrelated. So your nutrition is going to affect your sleep. It's going to affect your cognitive abilities. So yes, nutrition is a basis for any type of healing, just as activity is.
Yes.
It's basically learning how to pace. But there's another piece that I want to kind of throw in there, and that is you don't want to just sit in a chair and don't do anything. That'll be very boring, unless you're a Buddhist monk and you can meditate, which is okay too, if that's something that gives you pleasure. The point is, what do you love to do? Because if you find the things that you love to do that basically you now can do, that is going to enrich your nervous system, and it's going to make you feel better, and it's going to help you on that road to recovery.
Passion is healing. Passion and connection, and like you said, community is so important in any healing event. Tell me about your book.
Okay. So about a year ago, Chuck Lapp, who is the medical director at the Hunter Hopkins Center, and he basically was one of the early pioneers in ME/CFS clinical research. And I co-edited a book. The title is Understanding the Behavioral and Medical Impact of Long COVID, an empirical guide to assessment and treatment of post-acute sequelae of SARS-CoV-2 infection. It's a long kind of title, but there's 15 chapters, international collaborations. There's 38 experts. They review the pathophysiology of each organ system, identify current and potential research and clinical interventions. And it basically helps us understand existing COVID research and interventions. It's published by Rutledge. It's available by that publisher for about $66, but you can also get it on Amazon.
That's what I was just going to say. Can you get it on Amazon? If I'm sure a lot of people tell you this, if nobody else tells you thank you for doing this book, I have said that people that are not feeling well, that are dealing with post-viral illness, need to take this and put it under their arm and walk into their doctor's appointment with it, keep it by their bedside. It's I hate to say the word, but it's validating that there is such phenomenal science behind the way they feel. And I think there's a lot of dismissing of the patient that's happening right now that's just very heartbreaking. And I think that the way this is laid out, it's so based in science, which of course it is, but it also has a flow to it that allows it's complex ideas that allows everybody to understand it, though. I mean, there's some of it that as people read through, I have to go over it several times, but it's just an empowering thing for people to have.
So in your medical journey toward recovery and wellness, you're going to need to basically become your own scientist, your own clinician, your own physician. Because often the people in your environment are not going to have the energy, motivation, and drive to learn all the specific pieces. So to the extent that you can continue to learn, continue to become a scholar for yourself, your journey is like, in a sense, a sabbatical, where you're going to learn everything about you, everything that got you to where you are today, and where you can go into the future. And the only way of doing that is being armed with the best evidence that we can have that what science and research is basically saying can make you well.
And if your physician or your healthcare practitioner doesn't trust your experience, get a different one. And tell me one more time the title of the book. We grabbed ours on Amazon.
Understanding the behavioral and medical impact of long COVID.
And Dr. Jason, they can look you up too, and I found it under your name, under titles of books that you're with.
That's right. They can Leonard A. Jason. I have I think about 30 or so books.
Yes, this one is pertinent for the times. I think it's incredibly valuable that you arm yourself with this kind of data and knowledge. I have so much more to ask you, Dr. Jason, but we are out of time. Are you willing to come back? We would love to have you on again.
Happy to do so.
Wonderful. Thank you so much. And again, thank you for writing this book. The way it was put together allows us to, I feel like, walk in with a ton of data, a ton of research, but also something for us to study to, again, become our best advocate. So on behalf of everybody out there, my family included, that struggle with chronic illness and post-viral illness, just thank you so much for all the incredible work you've done. You have such a legacy of effort on behalf of all of us. So thank you. And I can't wait for you to come back.
Thank you.